I felt shame. I was so embarrassed that I was still in the relationship. I was afraid to leave. I had been to a couple of health professionals. They had been very bad experiences, and so I had lost my trust in telling health professionals anything.
Before training GPs and before I was actually trained myself, I had absolutely no idea about family violence, domestic violence, and I actually believed it wasn't happening within my practice.
Prior to doing the training, except for specific circumstances, such as in antenatal care screening, I would not ask about domestic violence.
We know that domestic and family violence are the leading contributor to death and disability for women of childbearing age. It's as common as diabetes or asthma. The aim of the Safer Family Centre is to transform the whole health system to respond to domestic, family and sexual violence. With the Readiness Program, where we are training primary care, we are doing that because we know that survivors tell GPs more than any other professional group. For the family violence sector and general practice to work together, they need to understand each other. The early intervention and engagement by a GP can really put a survivor on a pathway to safety and healing.
Sometimes GPs can feel like they're in it by themselves, and our specialist family violence service wants GPs to know that they're not. So when we collaborate together, we can achieve the best outcomes.
Everybody in the practice has a role, from the front of staff, reception staff, through practice nurses, practice managers to GPs. As a team, they can respond to this challenging issue. So when someone comes with signs of domestic violence, then the GP can ask and be a safe, confidential place for the survivor and her children, or in fact, the people who are using violence can also be identified.
The impact of the training was quite powerful. We noticed that before the training that GPs were just not quite sure that they knew enough to be able to respond appropriately to victim survivors of family violence. And then after the training, we really saw that their confidence grew.
The training's had a huge impact on my practice. I've found myself recognising subtle signs a little bit better.
As a result of the training, they were doing little projects at their GP practice about things that they could implement in their practice to make the environment a little bit safer for victim survivors. They were able to trust their instincts and recognise what they already knew.
The simulated patient, I think, is a real strength because it gives GPs a chance to ask the question in a live environment.
The important part is just to listen and validate. That itself can be hugely empowering for the patient.
The GP that I saw was supportive because he showed empathy, and I could read everything in his body language, tone of voice, that he was genuinely empathetic. He made me feel heard and understood, and it made a real difference to my ability to trust in health professionals from there on. Now I'm not afraid to reach out if I need help. The shame has dissipated.
I feel I have the confidence now to talk about it more sensitively and not fear the answer, not fear that they might say yes and not know where to go from there.
It was actually really confrontational to see how many patients actually then volunteered that they had been experiencing family violence. Patients who I'd known for years, who'd never said anything. They only opened up because I actually asked the question. Now, I only asked the question because I had done the training.